So I'll first introduce myself here. My name is Mackenzie Kehoe. I am an enrollment counselor in the online admissions department on behalf of George Mason. So I'm really excited to have everyone here tonight. Thank you to everyone who's taking the time to join us. It's such a great opportunity to learn more about the program and ask questions as you're making really important decisions about the next steps in your education. So thank you, everyone, and thank you to our faculty members for helping to provide such great information for our prospective students. So I will start us off by quickly just going through the agenda for tonight's presentation. And then I will pass it off to Dr. Sheingold and Dr. Uriyo. So first we will meet our presenters. Everyone will have some chance to go over your background and what brought you to Mason. We're going to go through the program details, the learning outcomes, course details, curriculum details. We'll talk through the Capstone project and then the opportunities that everyone has outside of the classroom, which is really excited. And then we'll wrap up by going through the admissions requirements, and you'll have a chance at the end there to ask any questions that you have about the program. So there'll be a good Q&A session at the end. Please use this as an opportunity to ask any questions that you have. Definitely take advantage of us all here today in any way that we can help. And then I do want to quickly just go through basic Zoom functions if anyone is not familiar with Zoom. Pretty user-friendly. Everyone is using the chat really well, so that looks good. So any questions you have, you can pop right in the chat. You can use the raise your hand function if you wanted to come off mute and ask your questions live, or you can use the Q&A function, which should show up as a button on the sidebar on your Zoom screen. And the questions will come right over to us. If you don't see it, you can use the little 3 dots which say more, and it should show up. So it should show some more applications for you there. So we'll do questions and answers at the end if you can save your questions for then. And then we'll go through everything there. Alrighty, and I'm going to pass it off to Dr. Sheingold and Dr. Uriyo, if you guys want to take a moment to introduce yourself.
Sure. So I'm Dr. Brenda Sheingold. I'm the program director of the MHA at George Mason. I've been there since 2018 in that role. And my background prior to going into academics was in trauma nursing, and thrilled to have such a good partner and colleague in Dr. Uriyo. We work together with the on-campus students and the online students all the time. And as Dr. Uriyo mentioned, we also endeavor to offer a lot of extracurricular activities for MHAs as a team. So welcome tonight.
Yeah. Yes, hi, good evening, everyone. My name is Dr. Maria Uriyo. I'm the assistant professor in the department, as well as the online program coordinator. I work really closely with Dr. Sheingold on this MHA program. Prior to coming to George Mason, I was at Johns Hopkins, and I did analytical type research for their claims department within the MCO. And then I also I oversaw the NCQ accreditation as well. So I really encourage you to take part in this program and actually, apply for the program, because it will really be influential in your career. So, yeah.
All right.
Oh, okay. So in terms of what makes our MHA program unique is that we are also CAHME-accredited, and that is a requirement that many employers look for, that you have your master's degree in healthcare administration from a CAHME-accredited program. Not only that, we're also ranked number 32 nationally by the US News and World Report. Our recent ascent up towards number 1, that's our eventual goal, is the award that we got from Canon for how we approach our curriculum, our program, and how we make it flexible and sustainable so that our students are able to manage life as well as learning as well as work. So our students are very diverse and reflecting the community that they come from, the community where the George Mason is at. So with that being said, you would feel welcome and you will acclimatize to the culture of the program and be able to do very well in your coursework. And then, of course, we have opportunities outside the classroom that was mentioned before, different clubs, different organizations, different events on campus, both in person as well as virtual. The only thing stopping anyone from, attending those is yourself in terms of engaging and taking action. I don't know if Dr. Sheingold, you have an additional points you want to add.
This is a network intensive degree, and we try to give you as many opportunities as we can through the program, but encourage you to begin that networking process wherever you are, wherever you're working or wherever you live. We'll establish a model for you through the events that we have, but we want that to continue outside of our program as well. So with the first one that's going to be coming up is a big meet and greet with the Innova executives to have resume reviews, lightning talks. That's going to be one of our biggest kickoff events of the year. I see that the three of you are somewhat local, so it's possible that you could come to campus for that, and we would love to see you. We often have online students that live local attend that event, and we had 300 people there last year that we provided meals for, and that had this included nursing and social work and bioengineering as well as health informatics. So it wasn't just 300 MHA students, but throughout the College of Public Health. We have a spring symposium in March that's hosted by our student association. There's a lot of opportunities through the MHA Student Association. That's all live streamed for the online students. And we recruit panelists. Last year we had, I want to say 12 that were recruited, 3 panels of 4. Then we had a keynote speaker on top of that. So it's a very rich learning experience. We also invite GW and Georgetown MHA students, so you're networking not just with executives, but also with your colleagues on other campuses. So that's just 2. I could go on and on, but I'm going to stop with 2. You want me to talk about this, Dr. Uriyo?
Yeah, sure.
So we have, we're competency driven in our curriculum, and that's because of our CAHME accreditation. And there's 5 buckets that our competencies fall under, and they're identified in every single class. What 5 domains are in your class, and then what competencies are covered in your class. And we're required to report those outcomes to CAHME in order to retain our accreditation. We're going to come up for reaccreditation in 2026. And, so that's something that you're going to be seeing on every single syllabus, and you'll hear us talk about competencies frequently throughout the program.
Okay, so in terms of the curriculum, it consists of 45 credits. And the left side shows you the required core classes that you have to take. Because we're in the College of Public Health, all our incoming new students will take a class in the Foundations of Public Health, GCH 500. And then on the right side, you'll see you have the ability to have a concentration in healthcare quality, or just have a concentration in the executive concentration. So this is a recent development, and before our students would have graduated with what would now look as executive concentration. You are the MHA executive. But now we're giving you the option of saying, well, I would like to go the healthcare quality route. So you have that option to determine what it is that you would like, what path you would like to take. And these are available for online and on-campus students. So our program is, whether you're online or traditional, everything is, everybody is getting the same learning. Yeah.
Same curriculum.
Yeah.
I would just add that the healthcare quality concentration is new for us, as Dr. Uriyo mentioned, but it's market driven. That's where it came from. We have an advisory board, and we interviewed over 30 employers, stakeholders in an MHA program, in order to come up with what employers really wanted. And they want skills and knowledge in value-based purchasing and healthcare quality. That's the wave of the future. And so that's why this particular concentration has been added. It's because of the employment value after you graduate.
Yeah. And then towards the end of the program, the last class that everybody takes is the Capstone practicum in healthcare quality and healthcare systems management, the 790 class. So whether you're online or traditional, you take 790. Yeah. We'll talk more about it, I think. Yeah. So this is the Capstone issue I was talking about. And what it is typically our students become part of a team or an entity. And typically you are working on a project that addresses an issue that the preceptor has or the organization has. And it is something that will be of value to the organization. And when we say you're going to be doing a project, it is a non-thesis project, and it's more of like an executive type level project that you're doing within 8 weeks if you're online, and more than 8 weeks, maybe 13 weeks if you're a traditional student. At the end of the project, you're going to be generating a report and a poster presentation. And the poster presentation, for those who are able, we presented on campus in the public health building in Peterson. You'll become very familiar with it, and many people within the college attend, and sometimes preceptors come and attend, and so that you're able to show what it is that you did. There are vast number of projects that students have done, ranging from telehealth, market research, like shadowing, working in the OR, looking at show times, different things like that, ER, looking at working with revenue cycle management. So it all depends what it is that you're interested in, and if you're able to find a preceptor. And sometimes we come in, not sometimes, we do come in and help guide you in obtaining that preceptor that you need. Dr. Sheingold, would you like to add anything to that?
Yeah, this is where your networking skills will come in really handy. We don't locate preceptors for you. You have one foot out the door by the time this last class, comes into the curriculum, and we want to make sure that you're able to navigate networking on your own. So we give you the skills, we give you tools to network with in the class, and you live all over the nation, really. And so we want you to network with people in your area, like I mentioned, mainly so that you can end up with this capstone project and employment after. I'll just give one example of a capstone project that was just recent. We had a student who was working, it's called the High Reliability Center with Innova Fairfax, where we live in Northern Virginia. They have 5 hospitals, and this was a central command center. It's also called a bunker, where they monitor all 5 ICU patients and their rhythms, and with a whole cadre of physicians, like probably I would say 25 physicians that are monitoring this. They have, multiple monitors in front of them. They also arrange transfers if patients need to be transferred to a different facility or a higher level of care, and all of the bed management in every single of those 5 hospitals. They manage that too. And there's eyes on cameras in the ICU with the patients to help give nurses a second set of assessments with a nurse that's monitoring a patient live in ICU at all times. So that's 5 different ICUs and 5 different hospitals where all of the functions that I just mentioned are managed remotely in the command center. So that's where she did her project, which was really an off-the-charts opportunity that almost no hospital system has that kind of infrastructure. So.
Yeah, so in terms of opportunities to get outside of the classroom, Dr. Sheingold mentioned the Rising Healthcare Leaders of Mason. That's the group of students that are responsible for putting together that meet and greet event that is taking place in the fall, as well as the symposium that takes place in the spring. And there are many other events that they take part in. All these events are opportunities for you to network and get to know the executives in the area. And also not only that, getting to know your own peers, because eventually are going to be working with them in one way or another. Mm-hmm. And then another opportunity is getting to interact with the National Capital Healthcare Executives, NCHE, which is part of the SCHE. As you become part of the MHA program, there are various other associations that you become aware of that would encourage you to become part of the student membership and gain the benefits of being part of that body. One of them is the Academy Health Student Chapter. And then, of course, there are many other health policy seminars that the department, Healthcare Administration and Policy Department provides and gives. And our chair of the department, Dr. PJ Maddox also sometimes gives some seminars and brings visitors or guest speakers on campus. So you should take advantage of those. And then, of course, this last one is not the least, but it's actually one of the opportunities that you have that you could become part of the various case competitions that students are able to take part in. Dr. Sheingold, would you like to add something about this?
I would love to. We have a case competition coming up for first-year students. That would be you in November. That'll be positioned at George Washington University. This is a small regional competition where you have just a day and a half to spend with students from 5 other universities: Hopkins, GW, Uniformed Services, Georgetown, and VCU, along with George Mason. So this is a competition where you're given an actual case to analyze, present it to a team of judges, and the judges decide first, second, and third place winners, and cash prizes are awarded to students on every team. So this past one, we just piloted it for the first time. The first place team won $1,000 each. Second place was $750, and third place was $500 each. And that's for a day and a half of work and time learning. All 5 program directors from those schools that I mentioned participated in education during that time. Dr. Uriyo gathered phenomenal data after that, which built a solid case of why we're doing it again this year. So that's one example. And then we also participate in NACE, the National Association for Health Service Executives, which is has been designed and has one of the oldest associations for health service executives. It's designed to promote Black leadership and to make sure there's mentorship. That competition is a national one. We just were so lucky. We registered a team. It opened on Monday. The registration opened on Monday. This is going to be held in October. They only took 30 teams and we got in. So there's a lot of schools that did not make it. but we were right there, you know, on the phone as soon as they opened, and we got one of the spots. So it's very coveted. It's a very prestigious competition, and we field a team there every year and pay for everything: hotel, airfare, the fees, the food, everything. So that's just a little bit about the competitions.
Mhm. So I think this is for you.
Yeah, I was gonna say I'll take over this slide, and then of course feel free to jump in and add anything else that you have on your end that you're looking for with applications too. But the admissions process is pretty straightforward. Everything is going to be housed right on our application portal. And we'll provide that information toward the end so everyone has access to the application. But what we'll need is copies of your transcripts from your bachelor's degree. You have to have your bachelor's degree from a regionally accredited institution. So we'll grab those transcripts. We'll need your professional resume. You'll also provide a brief statement of purpose essay about why you're pursuing your MHA degree, what you're hoping to achieve with your degree, what you're hoping to contribute to the classroom as well, and why you're a good candidate for the program. You will need 2 professional references. And then you will wrap up with a video interview. The nice thing about the interview is that you'll be interviewing with an enrollment counselor like myself. And you should, at that point in time, you would have had contact with your counselor through the whole application process. So you should know them. It's a really nice way to go through just some basic questions about what it is about your background that makes you a good fit for the program and why you're pursuing it. And we're usually able to get candidates their interview scheduled within the week. So it's a nice quick process for everyone to get all taken care of. And then Dr. Sheingold, Dr. Uriyo, if you're able to provide some information about the work experience that you like to see in the backgrounds of applicants specifically, and what you look for there.
Okay. I guess I'll start, and Dr. Sheingold, you can add. Yeah. So I would say the MHA program is open to individuals of diverse backgrounds. The only thing that you should have is the desire to learn, the willingness to learn, and being open-minded. And the other thing is the ability to network and desire to network in order to, be able to get the work opportunities that you're applying for in this program for. So we're looking for, your transcript, of course, will show us, the caliber of student you are. A GPA of 3 is good. That's what we're looking for. If your GPA is lower than that, there are other routes of how you can eventually get into the program by finding ways of getting your GPA up. So I would, there's so many, I guess, so many examples of the type of students we've brought into the program. Those who have some experience working in healthcare, those who don't have that experience, those who are coming straight from undergrad into the program. So it's vast. Those who actually have worked so many years in healthcare, and some who are also transitioning from working X number of years and they want to change career path. So it's vast. So Dr. Sheingold, do you want to add anything?
You said it so well. I think the only thing I could possibly add is some examples of degrees. Sports. We have people that have actually had an undergrad degree in team sports, and they've been some of the best students we've had because of their ability to quickly navigate problems and solve them, and they're competitive, and they're leaders, and physicians. We've had attorneys, we've had dentists, we've had nurses, we've had, like Dr. Uriyo said, no experience. We've had an accelerated program where people aren't even finished their bachelor's degree in health administration, and we take them. And we're actually expanding that program to other bachelor's degrees external to the bachelor's in health administration. So we have a big tent, and there's room for everybody in it. And we look forward to reviewing, I hope, what's going to be your application after tonight.
Yeah.
That's great. Alrighty. I think. All right, this last slide is for everybody to jot down the contact information for the admissions department. So there's our phone number, our email, the link to our website, and then the link to the application here too. So you can always feel free to reach out to us if you have any questions beyond tonight too. Or if you wanted to talk one-on-one with an enrollment counselor to review your background specifically, talk through the program details again, and we can make sure that this is the right fit for you and help you with the next steps of the application process. So please feel free to contact us. We're happy to help you with those next steps. And now I'll open up to question and answer. So any questions you have, please feel free to utilize the chat, the Q&A session, or the Q&A function again, and we will pass those over.
Yes.
Do you want to talk to that? Like when you get an application in, how long does it take before you would forward that to us to review? That's probably.
Yeah, absolutely. So you will be working alongside an enrollment counselor basically from your initial start of an application, or if you call in to get some basic information, you'll be linked up with an enrollment counselor to help you throughout the process. Once you're able to get everything completed for your application, meaning your online application is submitted, your interview is done, that's when we wrap up everything and send it over to faculty admissions committee for review. And typically from that time where your application is submitted until you have your decision, it's 3 to 4 weeks total. So you'll have your decision. Everything's reviewed on a rolling basis. So once we get it, we send it through. So we can get decisions as soon as possible, and you can get your spot secured for the upcoming term. Absolutely.
The rolling basis is very important. A lot of programs don't have that. They only admit one time a year with a cohort, and we admit, all year except for during the summer. So for summer, to start in the summer, but for spring and fall, we admit throughout the academic year for that.
Yeah. So there's another question about choosing a concentration. So you can, if you already know, you can choose a concentration like right at the beginning when you apply. If you don't, you can wait until maybe your second semester or your second session and then select your concentration. So you have time to determine what concentration you want. However, there's some people who already know and they decide.
Alrighty, it looks like Sandra has her hand raised, so I'm gonna see if we can get her unmuted. All right, Sandra, you should be able to unmute yourself if you want to come and ask your question.
Hi, can you hear me okay?
Yeah.
Yes.
Great. Thank you so much for putting this seminar on. It's so interesting and very exciting because I was not aware of all of the extra wonderful things that come with the program. Like, for example, when you were talking to us about the networking and about the seminars and the fall and spring seminars and stuff. I mean, that's really exciting. But I would be an online student, so I don't know how I would be able to participate with that. But actually, the main reason why I had raised my hand, sorry, I'm kind of jumping around here, is how long is the program, the MHA program? How long does it take from beginning to end?
It's 2 years and 1 semester. 6 credits are taken every every semester, including the summer. You take
Mhm.
6 in the summer, 1 class at a time for 8 weeks. It's accelerated in that way because, as Dr. Uriyo mentioned, it mirrors the on-campus program, but they have a longer semester.
Yeah.
And they don't take 1 at a time. So
Mhm.
that's one difference. I can circle back and answer your question about how do you participate as an online student, because we put everything possible on Zoom that we can. We just did a value-based purchasing boot camp that was Zoomed. We did a Black African American Heritage Month panel that was very well received. It's the 2nd year in a row we've done that. That was Zoomed. And we also allow for questions and interaction with the Zoom participants. For the spring symposium, that's an all-day event, so you can drop in, drop out. We post signs so you know when the next panel is going to start, and we monitor the questions, in real time at the symposium, so you can get your answers immediately from the executives that are fielding them on the stage. So we go out of our way to be inclusive like that.
That's
We
good.
also do something called the Dome Experience at Innova. Very unusual. One of the few places on the East Coast that has an operating room theater to watch open heart surgery. We've had a number of online students attend that experience, and we had one that flew in for it. So
Wow.
so we don't, we're constantly seeking new ways, Sandra, to be inclusive of the online program. I think we've made pretty good headway,
Yeah.
but we're always looking to improve. So if you come, we'll be looking for your suggestions and how
That's
to make
good.
sure that you are a part of our community.
Yeah, and I would
That's
just like to
wonderful.
Yeah, I would just like to add that even though you're online, any of the university services are also available to you. So like a career office, like the what's the other one?
The
For the
CAPS
well-being. Yeah,
for mental health, CAPS,
yeah,
the counseling
yes,
and professional services.
yes,
Yeah,
mhm,
you're right.
yeah,
That's really good to mention.
That's
Yeah,
wonderful.
mhm,
yeah,
So,
we've referred students there on campus and online with all the post-pandemic fallout. It's
mhm.
really nice to have that resource. We have an app for your phone that you can download. You're a George Mason student, you have access 24/7, literally, to mental health services at no charge. So we take student well-being very seriously for online students.
yeah,
That's wonderful. And what is really exciting is that it's not just, okay, I'm going through these, or we're going through these classes. It seems like there's a plan B, or there's a plan after you graduate. Because, a lot of times people are like, okay, I've graduated, I've put through all this effort and everything. Now what? But it seems like you have so many resources, and there's so much support. It sounds like there's a lot of support,
There is.
with the program, to where you're like, hey, you're graduated, so, you know, look into this avenue, or that kind of thing. So, and I think that's so important. So it's not like just, rubber stamping that, you got your master's degree, because you want to do something with it. You want to, be a productive, member of healthcare,
yes,
and help, help others, and, work with, your colleagues, and,
yeah,
so I think it's wonderful, actually.
So glad you brought this up, Sandra. Again, you're bringing up some really good points. We have a 93% placement in the field of choice, which is healthcare, within 3 months of graduation. We track
Wow.
very carefully, and we are required to report those outcomes to our accreditors, which is why why we keep such careful track of it. Because this is not a decorative degree. This is a meaningful degree. We expect you to become employed when you're finished with this degree, and everything we do is designed to make that happen. This is a
Mhm.
lot of your time, it's a lot of your money, and we don't waste any of it. So we take that piece of it that you mentioned very seriously. I also want to circle back about what you said about resources. George Mason is the largest public university in Virginia, and we do have a lot of resources, and we spend the money that we have on students, and we're accountable for that. So I'm very proud to say that we put students first in every way.
That's wonderful. So, do you have like a career center or
Huge, yeah.
Yes, there is a career center. And also, when you're talking about careers, one of the things that we as a department have is we make available to our students the individual development plan, like at the beginning, where students work with like a designated faculty to determine where it is that they want to go, what it is that they're kind of like weaknesses in that they need to augment, and then what do they need to do now to get to point Z where they want to go.
right?
So you don't want to arrive like you've gotten the degree and then you're asking yourself, now what?
Yeah,
We don't want that. We want you to know where you're going. Yeah.
that sounds, my gosh, that sounds so wonderful.
Yeah.
We're one of the few programs in the country, if not the only program in the country, that has an executive in residence. And he meets one-on-one with students for career counseling. And among many other things, he leads that DOME experience for students as a graduation gift I spoke about earlier. So having an executive in residence as part of our program and on our faculty is very unusual and unique, and just adds to employment after you graduate.
Yes, that sounds wonderful. So, I used to live in Northern Virginia, so and now I'm in Charlottesville. So, I work at UVA right now. So, it's not directly related to healthcare. I do have 4 years of healthcare related experience. But then my husband got very sick, and so I had to change gears a little bit. But I'm trying to recenter and get back to this big goal that I've had for a long time, and I'm ready to go for it. So
That's great. So
yeah.
I don't know if anybody else, Sandra, I look forward to your application.
Thank you.
And
Thank
want to
you.
make sure we cover all the
Oh, of
questions.
course. Yeah, I didn't mean to take all the
No, you didn't.
time.
No, I think you
No,
brought
but
up really good points.
okay, thank you so much.
You're welcome.
There's a question here about if you're working part-time, can you move through the program more than one class at a time? The answer is you take one class at a time. We don't allow like doubling. 8 weeks for one class is a lot, and 2 classes in 8 weeks is a huge lift, and it's like drinking from a water hose. So no, we don't allow that. And it's also CAHME, based on our CAHME application, we have stated that we're doing one class at a time. So for online students, so that's why we don't do that if you're doing part-time online. And I think Vanessa had her hand up. She still does. Yeah.
Let me go ahead and allow Vanessa. You should be able to come off mute now.
My name is Vanessa Wright. I'm already admitted into the program.
Oh, good.
Yes, I had a delay because I am a veteran, so navigating the VA for my tuition was a little challenging. But with that, so I'm a 30-year veteran. I have 0 experience in healthcare. However, I'm very interested in the program because my master's is in organizational management. And you spoke about networking, and I must give myself a pat on the back. I do a really good job at that, just because of wearing a uniform and having to coordinate and communicate with different people with various backgrounds. But one of my major concerns is what will I do with this degree? The first thing that comes to mind for me personally is because of my interactions with the VA, I would love to take this degree and the experiences that I have and just utilize that to make the VA system better than what it is right now. Can you please give me your thoughts on that idea?
Yeah, that's a great point that you brought up. And we have a course in leadership and organizational development, actually one of the very first that you'll take, Vanessa. And in that class, one of the case studies, and it's a case study based course, because that's the best way to learn ethics and to learn leadership oftentimes, is from some of the worst examples. The VA scandal that occurred several years ago. I think it's been about 10 years ago now, is one of the cases that is analyzed in detail by students and presented to the class. So the VA is still struggling to rebound from that scandal. So you would have the skills that they need, and they're recruiting. And you would be in a good position to make a difference, especially with your military service. So I don't know if that answers your question, Vanessa, but
No,
really
it
triggered
does.
something in me.
Well, it does, just because partly some of my concerns is because my master's is in organizational management with a concentration in leadership. And 30 years of service, so I retired in a leadership role. So that part of the program doesn't concern me at all. It's the healthcare, which I feel that will be a little challenging for me. But at the completion, my real concerns were, how do I take this degree and merge it with the experiences and the education that I already have to ensure that I'm doing something that I love and that's beneficial and personally rewarding to me?
Yeah. So I think one of your potential peers, Renee Tatum, says she works at the VA. So right now you can see there's already opportunities for you to network within your own peers. So for each class that you take in this program, I would encourage you to look at whatever material is being covered and kind of like look at where is your interest and how does it fit the VA. And then if you're able to, I don't know if you're working now, but if you're not, maybe find some part-time opportunities at the VA so you can start fine-tuning where it is that you want to eventually land. Yeah, and then you always tweak. Yeah,
you know what I've noticed. So I spent 2 years because I retired December 2019, right before COVID. And I spent some time being a governmental contractor, not rewarding at all. I did make a lot of money, but personally not rewarding or fulfilling. And I've had a lot of negative experiences with the VA. So I feel like that's my focus area. And a lot of it is just the structure and a lot of the red tape when you're a veteran seeking services.
okay. So then I would encourage you, since you're already enrolled in the program, I'll look for you in I don't know if you have the EDU, the GMU email.
Yes,
I will
ma'am,
look
I
for
do.
you. You do? So then I'll find a way of introducing you to the executive in residence so that you do your IDP, and then find opportunities within the VA, whether it's an internship or kind of like determine what areas you need to, improve on or focus on
Yes.
practically. Yeah.
Oh, that'd be great. Thank you.
Okay. You are muted, Dr. Sheingold.
The best thing to do is just send an email so that we have yours. And then Dr. Uriyo, like she said, can steer you towards the executive in residence.
Mm-hmm.
So please, please feel free to do that.
Yeah.
Alrighty. Any other questions? Feel free to keep using the chat, or we can always take you off mute. Good question so far.
And I bet you were the Beyonce.
Alrighty, I think that might. Oh, I think Josh. I'm going to go ahead, Josh. I'm going to take you off mute here. Joshua, go ahead.
Hi, can you hear me?
Yep.
Yes.
I don't know if you had a chance to see my Q&A just yet, but I am a recent registered nurse graduate from Old Dominion University, and I was potentially looking at this program for the spring of 2025, but I just wanted to kind of get your opinion. Like, do you think this program is a good program for a nurse who's looking to go into leadership compared to, like, let's say a master's of science in nursing?
Absolutely. I can answer that unequivocally, Joshua. We actually have Masters of Nursing students and Doctor of Nursing students in our 790 Capstone class that you heard Dr. Uriyo talk about. And the nurses are the ones the students vote to give awards to. It's happened twice, where nurses have been voted by their peers as MHA students to receive awards for their capstone projects. This is an excellent fit for a nurse. I highly recommend it in terms of leadership and advancing in the field. And I can honestly say I don't think you'd regret it. And I'm speaking to that as a nurse myself.
Okay. And then another question. So because I am looking to apply in the springtime, do you know when the deadline is for that, for springtime application?
I'm not really sure. I think
Yeah, it's the spring deadline isn't locked in yet. It's typically the first week of December. So you can always connect with your enrollment counselor and they can give you some reminders. And then we always send reminders as we're approaching deadlines too, just in case you don't have your application submitted. But the spring applications are open now, so you can always get it submitted. And remember, it is that rolling basis review. So if you think you are interested and you might want to start in spring, we always recommend to apply sooner versus later. So absolutely.
Okay. And I have a question about that too, because I basically have like my whole application completed already. But I have kind of limited work experience because I actually just graduated last year and then I just got my nursing license in March. So do you think that I would, I guess, still be a competitive applicant, or like would you wait until closer to the spring when I have like more work experience?
As I said before, we have admitted students who have just graduated from their bachelor's degree to those who have X number of years of experience. So the issue is if you've completed the packet, then apply. You shouldn't let that hinder you. Yeah.
Yeah, we have
Okay.
rolling admissions, Joshua. It's rolling admissions. So as soon as you apply, the application would be reviewed. The other advantage is that if you apply and you're accepted, then you can start taking advantage of the activities that we've already talked about tonight as an applicant. We've had several admitted students from the online program. I shouldn't say several because it's also rolling where they keep coming to activities, and that's how if they live in the area, we meet them for the first time in person because they're at that meet and greet and they're at the capstone presentations, and so even before you start, you can be included because we want you to hit the ground running. We're very serious about that. So new applicants come to our functions all the time.
Okay. Well, thank you. That answers my questions.
There's a question from Ni. I hope I'm pronouncing your name correctly. About application being declined, can we apply again and how? If it is declined because maybe GPA is an issue, there is a way of rectifying that, and you can either take some additional classes to bring the GPA up, and then you can reapply. I think that is probably many of the reasons why some are declined. Yeah.
So those are courses that you would take as a non-degree student, not admitted to the program, but they would be courses that are required in our program. So we would steer you to the right ones, get your GPA up, and then reapply. And those are some of our highest performing students. So don't let that stop you. Just get that GPA up so we can review the application.
Okay, the required GPA, the one that would get you admission immediately, I mean, not immediately, will get you admitted with everything else, is the GPA of 3. So that's the answer to that one. How many classes would I need to take? Well, the whole thing is 45 credits. So that is it 15 classes altogether? Yeah. Yeah. There is no minimum or maximum. It's 45 credits. You can go maximum, for sure. You can go over, but what you need to finish is 45 credits. Yeah. You're welcome.
Give it a moment to see if any other questions pop up. So Renee asked if she wanted to take an extra class, could she?
Yeah, you could, Renee. That's an unusual question, I must say, because usually people want to get their degree and and graduate. So you wouldn't be able to take an extra class in tandem with your required class because you can't take more than one at a time. But if you wanted to take something extra before you graduated, you could, for sure.
Alrighty, I'm going to throw this out for a last minute questions as we're approaching the hour mark. And then of course, if any follow-up questions come up after tonight's meeting, please reach out to us and we're happy to help you with the next steps of everything. But yes, use the chat or the Q&A or any last minute questions throughout. Alrighty, I think that is everything. Well, I want to thank everyone again tonight for taking the time to join us, and thank you to Dr. Sheingold and Dr. Uriyo for your time tonight. This is just always such a valuable resource for students, so we really, really appreciate it. So yes, make sure to save the information that's on the screen here. There's the application, there's our contact information. Reach out to us if there is anything else we can do to help. And thank you, everyone. Thank you for your time tonight. Have a great evening.
Thank you. Bye, everyone.